Health authorities said people returning to Laos and entering state-run quarantine centers will now be required to quarantine for 14 days at a state facility and another 14 days at a district quarantine center, thus spending 28 days in quarantine in total. All returnees who test positive for COVID-19 will immediately be isolated and sent to a hospital or medical center for observation or treatment. Deputy Director General of the Department of Communicable Disease Control of the Ministry of Health, Dr. Sisavat Sutat Nilasai, told a daily press briefing that the changes was announced to local authorities after Savanakhet Province's Task Force for COVID-19 Prevention and Control last month reported cases of people testing positive for the virus after leaving a quarantine center in Songkhon District. The new ruling did not make any reference to people quarantined in designated hotels. District officials should monitor people spending time in local quarantine centers to ensure they have not picked up the virus. Local authorities should maintain uniform standards of self-monitoring and quarantining at state level and district level quarantine centers to prevent the spread of the virus. District officials have also been instructed to monitor efforts to facilitate the quarantining and safe return home of migrant workers returning from neighboring countries. According to the National Task Force for COVID-19 Prevention and Control, quarantine centers in some provinces will be enlarged to better accommodate the large number of returning migrant workers. All returnees who test positive for COVID-19 will immediately be isolated and sent to a hospital or medical center for observation or treatment. The task force has advised people isolating at home not to go out for non-essential activities and to avoid coming into contact with other people. Family members or employers were required to ensure their daily needs are met, including providing them with food during their time in quarantine. Individuals who are self-isolating are required to monitor their condition daily for any flu-like symptoms, coughing or breathing difficulties, while frequently washing their hands. Returning migrant workers spending 14 days in quarantine at home can go out for essential activities, but are required to wear a mask. Anyone who develops flu-like symptoms should contact the local COVID-19 task force. The number of COVID-19 cases reported among returning migrant workers has increased dramatically over the past month compared to previous months, the National Task Force reported.